Link. I'm Dan.Pfister, and this is Healthcare Stories, Building a Patient-Centric Supply Chain. Supply chain organizations in healthcare have been in a state of transformation for a long time. Some of us tenured hospital people will remember when supply chain or materials management was called central distribution, and everything went through that single channel. Linen, sterile processing, and case cart were all part of a single organization. Technology was one of the main reasons for this support structure. The early healthcare enterprise resource planning systems, or ERPs, were integrated. All supplies were labeled with charge stickers, and CS managed most of the charges for revenue reimbursement. Purchasing and finance were tied via technology. The cost and revenue sides of the house were connected. Over time, technology vendors acquired or built new platforms that performed certain department-level functions better than the previous integrated ERP, and the segmentation of services started. The influx of managed care plans in the late 1980s also started to influence the consolidated service model. Once commodity supplies were not reimbursable, charge stickers, charging, all became pointless. Items that were unique to a patient or a procedure could be reimbursed. Common items had to be absorbed somehow. Driving cost out of the supply chain became even more critical. Lower-priced alternatives, strategic contracting, preferred vendors, annual cost reductions, capping implant costs, flipping the custom packs, changing prime vendor or GPO. Supply chain leaders went hard at the cost side of the business. A typical PAR location in a nursing unit may have 500, 600, 700 items, and suddenly the majority of those supplies were not reimbursable anymore. Supply chain was transformed into a non-revenue producing department. Patient care still required supply chain to provide every Band-Aid, IV bag, needle, syringe, slippers, chucks, but supplies were now a drain on the organization, the cost of doing business. A patient-centric supply chain acknowledges the challenge of delivering high-touch service and providing quality supplies, coupled with the demand to drive down acquisition costs and reduce waste. A patient-centric supply chain seeks to understand demand patterns, but there is a gap between systems of inventory control and clinical systems of record. Advanced analytics, outcome management reports, business intelligence dashboards bridge the systems gap, but before all that comes assessments, observations, and understanding the workflows. Supply chain needs to climb back into the driver's seat and get closer to the clinician, closer to the patient demand signal. It's more than PAR level setting. It's about visibility, pattern recognition, about understanding what is happening, and then acting from that understanding, from that core knowledge, making decisions on supplies, utilization, seasonality, level loading, spend, and service. Predictive analytics, yes, but the database isn't the source of truth. Working backwards from the patient is the engine that drives transformation.